Welcome to The Digital Patient, where we discuss the latest advancements in digital patient engagement and share stories from the front lines. Today, we're joined by our very special guest, Dr. Claire Graves. Dr. Graves graduated from Yale University and earned her medical degree at Mount Sinai School of Medicine. She completed a residency in general surgery at New York Presbyterian Hospital, Columbia University, and attended UCSF for a fellowship in endocrine surgery and a research fellowship in surgical innovation. She is certified by the American Board of Surgery and holds a certificate for the Da Vinci system robotic training. Dr. Graves' clinical and research interests center around surgical treatments of disorders of the thyroid, parathyroid, and adrenal glands, with special clinical interest and expertise in surgical innovation and minimally invasive techniques. She is also interested in the ways that patients experience their diseases, treatments, and interactions with healthcare. Outside of the hospital, Dr. Graves enjoys running and hiking, traveling, practicing yoga, and exploring Sacramento with her husband and dog, Billy. Dr. Claire Graves. Claire, can we call you Claire?
Absolutely.
Awesome. Claire, welcome to the show.
Thanks so much for having me, and thank you for that very kind introduction.
You're welcome. Just a question I have, is Billy your dog or your husband, or are they both Billy?
Just my dog, yeah.
Awesome, okay. Well, it's honestly fantastic to have you on the show today. You've been really a champion of pioneering digital patient engagement for Endocrine at UC Davis, but really just championing digital technology for patients. The question that I had right off the top, given that your last name is Graves, I was wondering, are you related in any way to Robert Graves, who coined Graves' disease?
That's a great question. I have to tell you that your question sparked a little bit of a deep dive into my family history with my parents. So we chatted about it this weekend. So no is the short answer. Dr. Graves was in Ireland in the mid 1800s, and tracing back, it looks like the Graves side of my family actually has been in Virginia since around the 1600s. So wow. We trace it pretty far back.
Yeah, that's awesome. So wow, that's really
maybe
cool.
way back there, but nothing directly.
Right. Oh, that's really sweet.
So Dr. Graves, if that's not the connection, then how did you end up deciding on endocrine surgery?
Good question. I do feel like there was some element of destiny with my name, but really it's all, I have my mentors to thank. I was lucky enough to work with James Lee and Jen Kuo at Columbia University, and then during my fellowship at UCSF, and really working with Dr. Lee and Dr. Kuo during my residency. I realized that I really loved the diseases, I loved the patients, I loved the operations. It just really sparked a passion in me for endocrine surgery.
It's funny. So like Ellen and I did an episode with Dr. Namiri, who's a bariatric surgeon out in the Carolinas region. And he had a really similar response where one of his mentors, actually, I think also in California, I think, was it at UC?
That was UCSF Fresno, yeah.
Oh, okay. Dr. Higa, if I'm saying his name right?
Yeah, Higa.
But he was saying the same thing, where the mentorship there really sparked his interest in bariatrics, which makes me wonder, if you just found like a great mentor in almost any specialty, maybe you would have ended up there. You never know.
I had a lot of great mentors, but yeah, I think that's absolutely true. When you get to work with people who love what they do, it's hard not to, love that too. Not always, but but certainly in this case.
Fair. So Claire, actually, it seemed you were almost destined to pursue something like endocrine surgery. Back from the research that we've done, you've always been pursuing academic excellence. If I have this correct, you were back at the Georgia Governor's Honors Program in high school, back in Georgia growing up, which is a super prestigious program to get into. I'm curious, as long as that's correct, where did that motivation come from?
Yeah, that's correct. That's a deep dive. I have strong ties to the Governor's Honors Program. So I was a student there in high school, and then I actually was a counselor there for 3 years in college. So 3 summers was my summer job. It's a fantastic program, a really special experience for Georgia high schoolers from around the whole state to come together. and each student has their own major that they're sent in, and they're nominated by their school, and then they get to pick a minor. And it's sort of like a little mini, college experience where you focus in on things that you really love. So I was a communicative arts or English major, and then I minored in improv theater, actually.
No way.
And again, I think it really boils down to mentors. In my high school, got to nominate, I think, 2 students for the program, and contacted me and said, "We think you'd be a good fit. What do you think about it?" And so I'm just lucky to have people that, believed in me and thought I would make good use of that opportunity.
So Al and I are actually, I think, both very big improv fans. And actually, I think
Really?
yeah, I think was it Asker's or was it Sage's? We were in Seattle a couple of years ago, and we went to, I think, the local improv theater.
I recall, I think it was Oscars. We went to the improv. It was super rainy that night.
Yeah. So Claire,
awesome.
Is there a big improv scene in Georgia, or where did that start?
I was like, it's summer and I don't want to be in classrooms for my whole day. And so I looked into, visual arts and performing arts, and I did some theater, and I'm a singer. I was a singer all through high school and college. So I kind of on a whim, I was like, well, I've never tried this, but I might as well. Now's the time to be able to try it.
Yeah.
And so I have never performed, outside of that experience in improv, I have to say. But I had a great time. I made some really good friends, and I do love going to shows and, watching it.
Yeah, that's awesome. Well, now's your chance. We're going to do some improv on that. I'm kidding.
Well, this whole thing is kind of
So actually, Claire, I was curious then, after high school, what drew you initially to New York? Why did you choose to move so far from home, and what was special about New York to you?
So I am not someone that had always been fascinated by New York. It sort of came to be because of a specific program that I did at Mount Sinai Medical School. So Mount Sinai has a Humanities Medicine program, which is an early application program to med school for students who are humanities-focused, humanities majors, to be able to apply early, get into med school without having to take the MCAT. So I joke that I snuck into med school through the back door. So we didn't have to take the MCAT. I got to take physics and organic chemistry requirements at Mount Sinai during the summer, so that I could pursue other things during college. So I was actually a religious studies major in college, and I did a lot of art history and a lot of political science, and less science classes because of that program. And so I heard about that program completely randomly from a friend that I was having dinner with my freshman year of college, who was a year ahead of me and was applying for it. And I said, well, that seems like a really good fit for me. I'd always thought about medicine, but had been a little bit hesitant about giving up other things in order to do those pre-med requirements. And so I was lucky enough to get in during my sophomore year. And so that's how I ended up in New York. That was a long roundabout way of explaining that.
That's awesome. I'm curious, with your background being in arts and religion and like not science directly, how has that impacted your scientific method and the approach that you take today? Has there been do you recognize anything different because of the background that you've had?
I think it comes in all kinds of different ways. I think just having that sort of broader mindset and sort of looking at a humanities sort of brain, where I look at things from different perspectives and kind of think about things from a bird's eye view, sometimes that science tends to look at more on a microscopic level, I think can only help in your interactions in teams and with patients, and multidisciplinary discussions, just really sort of taking things in the whole picture, as opposed to looking at different tiny aspects of them.
Right. And that to me is so fitting with endocrine and the endocrine system, because it is such a holistic system. That's
absolutely. Yeah. Maybe that's maybe that was one of the things that drew me that direction.
That's awesome.
That's going to be a great podcast title, from improv and theater to.
That's right. So Claire, then after your medical school, what happened? You got tired of the cold weather and you decided to move out west and go to California, or what drove you there?
So I initially went out to California during residency, in the middle of my residency, for a research fellowship. I thought at that time I was going to be a pediatric surgeon. That was my focus. And so I went to work with one of the pediatric surgeons at UCSF, Michael Harrison, who is known as a father of fetal surgery. So he really pioneered fetal surgery. And as part of that, developed new devices and really had to innovate and come up with tools, brand new tools for these things that had never been done before. And so he has continued that innovation and has been coming up with all kinds of primarily pediatric surgery focused medical devices, but for adults as well. As part of that, UCSF has really embraced it. They have a surgical innovations program, and they sponsor surgical residents every year to be a surgical innovation fellow. So I initially went out to do that, and then ended up switching gears into endocrine surgery, but also UCSF has an amazing endocrine surgery fellowship. So that was a nice sort of segue into that. And in the midst of all of that, I ended up meeting my husband, who is from San Francisco. So it's hard to get a Californian out of California, as I have discovered, but that's okay. I am very happy with California as well.
That's so cool.
Especially right now. I was laughing with some friends that are, in teen temperatures in the snow, as you guys may also see.
Wow.
Very much so.
Outside today, it is covered in a lot of snow.
Yeah.
Yeah, I can't complain about
we got a huge storm. It was yesterday.
Yeah, yesterday.
Oh,
I'm not kidding.
There's like 3 feet of snow. Yeah.
Oh my God.
Yeah, there's a lot.
Sorry, I'm taunting you with my window right here.
No, that's awesome. Well, so, that's an amazing story. And it's really awesome to hear that, the surgical innovation kind of found you over there, and that's, what's kept you. And it's really no surprise then that, all of the success of the work that you've put in over the years has started to really pay off. And, you've received multiple awards throughout your career. Most recently, I saw it in 2019, you got the International Association of Endocrine Surgeons Travel Scholar Award. I was curious a little bit about that. What happened there? Did COVID kind of impact those plans, or were you going to share research internationally?
So luckily that happened right before COVID. We were, it was August of 2019. The organization had a meeting in Krakow, Poland. So I was able to go there and to present our work, which was a great opportunity. It's really a fantastic organization of endocrine surgeons from all over the country, and a great opportunity to just share what people are doing elsewhere and really learn from our colleagues internationally. So I was very lucky to get to do that. There was a meeting in 2021 in Kuala Lumpur that was scheduled, that got canceled, unfortunately. But hopefully this August is in Vienna, Austria. So we're hoping that one will be able to happen.
I hope so.
Yeah.
That sounds awesome. I think one of the things that we came across in our research, Claire, was that often you've described surgery and medicine really a team sport, which, I mean, I think we hear that sometimes, but it's obviously like some people probably live it more than others. It sounds like you really believe in that. What influences that view for you?
So I think it's a really fitting analogy for a lot of medicine and surgery, on multiple levels. I think one of the things that drew me to surgery in the first place is, how an operating room is really, it just embodies that idea of a team effort. You have everyone from in the OR that is working towards the same goal, which is getting the patient through the operation safely. But everyone kind of has their own piece, and you can't do other people's parts. I can't operate on the patient and be an anesthesiologist at the same time. You need anesthesiologists focusing on, keeping the patient physiologically intact and intact airway and safety. And you need the surgeon to be focused on the operation. You need your support staff and your nurses there in order to do your job. Everyone is really there with the same goal. It's a single focus. It's just a really neat experience. And so I think that's one of the things that drew me to the OR. And then, I also think it gets played out on multiple levels, especially in medicine. Everyone's becoming very subspecialized and has a specific focus. But you can't do it alone. You have to have an expertise in one thing, but also keep an open mind and bring in experts on other things, because patients aren't going to fit into one specific thing. They have lots of things going on, and you have to work together to figure out what's going to be best for that specific patient.
I think one of the things that folks underappreciate in terms of the complexity of the team sport in surgery medicine is that, let's say in a company like SeamlessMD, we have the same team, right? We don't really rotate people in and out, but when you're in medicine, I mean, you might have residents and fellows rotating in and out, or even if you're in a community hospital, it's different folks on service at the same time. In the OR, the anesthesiologist could be different today than it was yesterday, the nursing staff, the surgeon. So it is a team sport, but it feels like you have like a team that can change dynamically depending on the day. And it just seems really hard to be able to be that cohesive in that environment. And it's a very high risk environment. So I'm always in awe at how folks in surgery medicine can somehow make that team sport work, despite the fact that frankly, your team is changing every day. It's pretty crazy, isn't it?
No, that's a really good point. And I think, we're especially feeling that right now in the midst of COVID and staffing shortages. So it's totally true. You come into work one day and so-and-so is out, but so-and-so is covering. And I think you have to maintain that sense of flexibility of, okay, well, here's our task for today. Whoever can help me get this job done, this is what we're going to do. So you're totally right. It's an ever-changing team, but keeping that focus, and it's nice to work with people who all are here for the same reason, right? We all have a higher goal, and that's why we are doing what we're doing. So I think as long as you keep that focus and are flexible, you can accomplish the task at hand.
Yeah, and I think especially during COVID, I think folks on the outside, we often have underappreciated like how much like frontline workers like yourself have gone to bat for the public. I mean, so here with the big snowstorm yesterday, I was hearing about how there were healthcare providers who, were driving to the hospital for work and like miles of snow and like, feet of snow. And a lot of them got stuck on the road. So they're getting out of their cars and they're basically just walking the rest of the way to the hospital because like their patients take care of, especially during COVID. So it's just incredible. Got a bit sidetracked. Alan, you want to bring me
No. No, I think you're exactly right. We were talking this morning that, it's how much it's shifted from, everyone focusing on, okay, there's this acute event, we have to work through it. And this is really becoming a chronic issue, and just trying to keep everyone's morale up and everyone, I think it's getting harder and harder to sort of push through this, what was an acute event now is sort of a new way of life. So I think that's going to be an interesting challenge moving forward. But absolutely, I mean, I feel so lucky to work with, people. I don't feel like I've been at the front line as a primarily elective surgeon, but absolutely my colleagues that are in the emergency room and in the ICUs are really, I think, taking the brunt of it. And it's just been awe-inspiring to watch for sure.
Yeah, definitely. So, it comes across like you're very humble, Claire, Dr. Graves. You are incredibly humble, and I think it's interesting because from if anybody does any research on you online, you'll see you just have the most enthusiastic praise from all of your patients. There's only ever 5-star reviews out of 5, and correct me if I'm wrong, but it's not rigged. It's not you haven't paid these patients to do that. And so I'm curious, like, how do you think your participation, or how do you show up each day to really impact the patient experience and put patients first? What is it that you're doing that's contributing towards that positive patient experience?
Well, that's a very kind question. I just feel lucky to get to do what I do. I really feel like it's a privilege to get to take care of patients. And one of the things I enjoy most about my job is getting to know my patients as people. And, I think just that aspect of it, listening to what they have to say and taking into account, kind of other things that may be going on with their life and how that's affecting the problem that they're there for, even if it doesn't seem related. I think taking the time to really get to know someone and listen So often we're sort of rushed through things, but just really listening to a patient, I think is number one thing that I try to do when I see patients in clinic. And I think that goes a long way. I think people really appreciate that, and having that time and that connection with their doctor.
Right. Yeah. And I think, we hear that a lot. And I think if you could stay connected to a patient 24 hours a day, every single patient, at scale, that would be the ideal situation where you're able to really check in with each patient, listen, hear what's going on with them, and then, figure out a way to solve it together. It kind of brings me to the next point. We're talking about COVID and, staying connected to patients. What's neat is your program actually implemented digital patient engagement or SeamlessMD's app in 2019, before COVID even hit, which in reality is an early adopter. You were looking for surgical innovation and you wanted that connection with patients. I'm curious, what was it that motivated you to really bring digital care to your patient population?
Yeah, I think it's a perfect segue, because I think that's absolutely our goal with this. And I have to give my partner, Mike Campbell, the primary credit for having this foresight, because he was the one that really championed this initially before I got here. But I think you're exactly right. I see the Seamless app helping patients in a couple different ways. Number one is educating patients. So, if I have a limited time with patients, I'm spewing information at them about their condition and surgery and, minute details about what's going to happen. And it's a lot to take in one go, especially when, things are highly emotionally charged. When you're telling a patient they have to, undergo surgery, it becomes sort of selective what you can even comprehend at the time. And so having that app there that has, our specific information for our procedures, our patients, our institution that they can go back to and look at later, is so key. And then, after surgery, also the engagement aspect of it, well, before surgery too, but, having a place where they can check in, and it's sort of a virtual extension of Dr. Campbell and me, to say, hey, how's your pain today? What does your incision look like? Here are the things that we're worried about and we're thinking about. And you can, virtually communicate with us and check in that way.
That's awesome. And I'm curious, what feedback have you gotten from patients on this kind of more digital experience?
I've gotten really good feedback. Patients are really enjoying it. I think, it's not for everyone. It's another, app for people to sign up for. And so I do take that seriously. Sometimes people are a little bit overwhelmed, but patients that are into it, I think, patients that are more sort of digitally engaged at baseline are really excited about it. They said, this was so nice. I felt like, I knew what to look for. It took away, I joke about the black box of surgery, where a lot of times, you go to surgery and then you come out of surgery and there's, just a lot of mystery around it. They said, it took away some of that. I knew what to look out for. I knew what to be concerned about and what not to be concerned about, what was normal. Patients are always worried, well, is this normal? Is this not normal? And so a lot of that normal or not normal, we can, just cover with some education. But it's so hard to just fit everything into those in-person visits. So to have this extension of us is so key.
Yeah, it kind of reminds me how, I myself come from the clinical world. So if I have, a parent or a loved one who's going through a journey, I think sometimes I take for granted, like my ability to, interpret the information they're given and help them get educated and understand it. And so I think one of the things that, we've learned from that here at Seamless is, okay, well, we have to break that down into bite-sized pieces or lower the literacy level or just make it easier for folks from all kinds of walks of life to understand. So it's awesome to kind of hear from, frontline clinical experts like yourself who really get the value of that. One of the things that we've heard from our team members who've worked with yourself directly at UC Davis is you've been a pretty big champion of actually, I think, educating patients on the initiative and kind of being really involved in the adoption. Not every, physician thinks that way. Sometimes I think some physicians rather that be handed off to others on the team. Is there, I guess, any reason why you think physicians should play, maybe more of a role in kind of helping to drive adoption?
Yeah, I think it depends on the institution and the situation. For me, I find that, I've just spent that hour with a patient building trust and getting to know them and introducing them to what's going to happen, if I say, hey, here's this thing that I think will help us, in your path to surgery and afterwards, that has a lot more weight than if someone else comes in, a new face. Again, the team aspect is certainly important, but a new face comes in and says, hey, here's this other thing, more paperwork to do. It's a little bit different than if I personally just introduce it to them and explain why, that if there's a reason why, it's much easier for me to explain that than someone new coming in and trying to start from the beginning with that.
But by the way, you are completely right based on the data that we've seen internally, where again, you're right. Not every organization has the same resources or time for physicians to be as involved in that education, but for the ones who have the time to invest in it, it definitely actually pays off in adoption and engagement rates. And I think what we just found is, to your point, when the physician who spent so much time building trust really advocates for something, even if it's like 10 seconds of advocating for it, the adoption is actually that much higher. And it's kind of like if your physician asks you to follow a treatment protocol, you're just a lot more likely to be compliant from what we've seen. So yeah, the data backs up exactly what you're telling us today.
Oh, interesting. That's good to know. That's good to know. Yeah, I think it just makes a big difference to know, why too, right? Patients are going to be much more engaged if they understand why they're doing something than if it's just a blanket statement of do this. I think for all of us, it helps to have that internal motivation to know, why am I doing this?
So it's funny. So that concept, I forget what it's called, Alan, but I know from our health literacy experts and patient education experts, they've shared that same concept with us. And so I think you're the first one that's actually brought up that concept around and what do you call it, internal motivation coming from understanding why you should do something. Yeah, I think it's like behavioral change theory, Alan, or I think I've heard that from folks here, but I don't know if that's because of your humanities background, Claire, that you actually have that insight, or I don't know, but I haven't heard that from a physician so far. I've been doing this for like 9 years now, and I haven't heard that from another physician. So kudos to you.
That's interesting. I did not know the technical name for it, but that's good to know.
You intuitively figured it out. So that's awesome.
That's great. So Claire, we had a question. As the industry shifts more towards value-based care and pay for quality or fee for quality, one facet of surgical quality that is becoming increasingly relevant are patient-reported outcomes, or PROs. Total joints and orthopedics, hip and knees, for instance, PROs have even started coming into the payment models and reimbursements, and they're weighted for the actual patient-reported outcome. So their question is, why do you feel that PROs are so important to collect regarding quality of care? And I should just preempt this by explaining that you are collecting patient-reported outcomes with SeamlessMD and this digital technology. So the question is, why do you feel that it is important to collect these PROs?
I think you're exactly right. I think in the US, there's a big push towards that becoming a metric or a more standardized metric. And I think there's a couple reasons for that. I mean, number one, our goal as physicians is to help patients and to improve their lives. And so it seems like the most logical outcome to assess, right, is how do patients feel that we're helping them, or are we helping them, or are we not helping them? So I think I think that there's really no better outcome than that. So it's key to check in and just make sure that we're accomplishing the goal that we want to be accomplishing, but from the patient perspective.
I guess, Claire, as clinicians, we often worry a lot about clinical outcomes, so complication rates, mortality, readmissions, et cetera. But often patients have a different view of what success is for a surgery. So, using orthopedics as an example, again, that could be, I want to, walk up the stairs without pain, or I want to be able to, walk my kid down the aisle at her wedding, next year. I'm wondering from a patient perspective in endocrine surgery, how do patients view success for surgery? Because I'm guessing it's quite different than maybe what a surgeon might think.
Yeah, I think this is absolutely a big point in endocrine surgery. Luckily, our outcomes, from a technical morbidity and mortality standpoint, are very good. And so, I think it's we're definitely learning more about patient-reported outcomes and how we can better incorporate them into our practice. So there's a few, thyroid-specific patient quality of life metrics that we've been working with in the field. But I agree. I think, the major things that we worry about in thyroid surgery or parathyroid surgery is recurrent laryngeal nerve injury. So voice quality plays a role. And then obviously major things like a hematoma and calcium levels, which can sometimes be a little bit tricky to measure symptoms from. And so with some of these sort of more vague quality of life issues, I think our metrics aren't perfect yet, but we're working on that and trying to figure out exactly what patients are looking for and what constitutes success.
And I know earlier in the conversation, for you, the sort of in-person, or not even necessarily in-person, but kind of the face-to-face interaction with patients, you felt was really important for the overall patient experience. I know since COVID, you've probably done a lot more telemedicine and virtual and all of that. But I guess now, what are we, like almost 2 years into COVID? I think a lot of it shifted back towards face-to-face. So given that you've now had the experience life as an endocrine surgeon with not so much virtual, a lot more virtual, and then now maybe it's kind of plateaued a bit. Where do you see that going in terms of, is more virtual care for endocrine surgery in the next couple of years? Like, what do you think is going to stay virtual for you? What do you think is really not working out virtual? Like, what's been that like? What's that been like for you?
That's a good question. I think we're learning a lot with this new era, sort of being forced into doing more virtual visits. And I think, I certainly like meeting patients in person before I'm going to operate on them. I think it's so important to, little things like watching them come into the room, how mobile are they? I think you get a much better global sense from seeing a patient's whole body in person as to, how they're feeling, how anxious are they, how sick are they, or other things going on that I need to ask about. So I think seeing a patient in person before I operate on them is still very key for me and something that I've been pushing for. But I do think that, for a lot of our routine post-operative visits 2 weeks after surgery, I need to see their neck. And so luckily I'm able to see that over Zoom, which is nice. And a lot of our patients, in our Northern California area are coming from, 3-4 hours away, way up towards Oregon or, in the mountains, in the Sierras. And so to have them, take a whole day off of work to drive all the way in to see me, for me to take a look at their neck, just doesn't make sense. And so as long as I can safely see what I need to see and talk to them and make sure that everything's okay, we have moved towards doing a lot of those routine post-operative visits virtually. And I think patients have really appreciated that. I think there's somewhat of a personal choice. Some patients would rather drive and come see me, and they feel more reassured being there, and so that's fine. But patients that are comfortable with it, I have no problem with it too. So I think there's a patient comfort and choice aspect to it as well.
Could I ask you a really far off, surgical innovations technology question? And you could tell me if this is just really, really dumb and all that, but because I know we were reading your bio and you were really big into innovation surgery, and especially because you're in California, maybe you're following along with all the, I don't know, the whole metaverse stuff coming out, Facebook becoming Meta. And I'm just wondering, when you think about the future of surgery and the fact that with things like the metaverse, or even just, let's call it more virtual reality, you could imagine a world in the future where you're physically in California, but maybe through robotics and more of a metaverse experience, you could operate on someone in New York. Do you think we could experience that in our lifetimes in surgery? Do you see that making sense at all or not? Love to get your take on that.
Yeah, I think that's a great question. I think that the technology is definitely getting there. And I certainly think that's going to be something that we're going to see in our lifetime. I think, obviously there are so many levels to it. You have to have someone that's there. What if something goes wrong? You have to have a competent team ready to take over at the bedside. But I can certainly see it happening where you have, a team at the bedside, and then, someone highly specialized comes in, from remotely to do something. So I do think that's going to happen soonish.
Mm-hmm.
And the other thing that comes to mind is, I know, like, I'm not sure if UC Davis does a lot of telesimulation kind of teaching, but I think people often kind of video in for that. But I guess imagine a world where you're in a metaverse and you could actually be there with, the trainee and work with them on the patient. That'd be kind of neat. So, wow.
Yeah, absolutely. Yeah. I think there's a huge, market is what I want to say, but opportunity for education and virtual simulation. I so much of surgery has been traditionally learned by doing, the traditional surgical see one, teach one, or see one, do one, teach one.
Right.
And there's been, with more realistic virtual simulators and encounters, there's been a appropriate reassessment of, is this really safe? Now we have other alternatives. We need to rethink this. We need to do more virtual simulation. We shouldn't be, practicing on patients. And I think there's a healthy mix of both of those things. You have to, I think you have to, under appropriate supervision, also learn by actually doing things. But absolutely, there's a huge opportunity for more virtual simulation and education in surgery.
Do you think there could be a future then where, like, let's say you could really well image a patient completely, like 3D wise, and then translate that into a virtual reality environment? Do you think as a surgeon you might actually practice that actual case before you went and did it at some point in the future?
Yeah, I think that's a possibility. We've been, Dr. Campbell and I have been playing around with a few 3D printing models for things, things like neck hematomas to teach residents how to, quickly be able to reopen the incision and release the hematoma. And I definitely think with 3D printing and 3D modeling and better imaging, I think that's absolutely going to happen.
Oh, that's incredible.
That's actually really cool.
Yeah, that's really awesome. And being in the Bay Area, you're likely exposed to all of these new companies and innovations all the time. One last question that I had for you, Claire: if you could give advice to any other physician leaders out there regarding adopting digital patient engagement, or at least a patient engagement strategy that's well equipped for our new kind of virtual care world, what would your advice be?
I think just being able to take advantage of the technology that we have. All of our patients, or most of our patients, are walking around with a computer at their fingertips, and so that's just a new method of being able to interact with our patients. And so I think to be open-minded and really, look at all of the options that opens up, and sort of rethink our traditional model of doing things, and think about how we could do it better.
Oh, that's great. So just being mindful of your time, Claire, we're going to shift the conversation to what we call the Fast 5 lightning round. It's basically 5 questions to get to know you a little bit better for our audience. The first question we have is, what is your favorite book or book you've gifted the most?
So I have 2, if that's okay. But my favorite book from childhood is Matilda by Roald Dahl. Always a favorite book. And then recently I've been gifting a really amazing book called Good Talk by Mira Jacobs. It's my first and only graphic novel that I've read, and it's just fantastic. And so I've been highly recommending it.
That's awesome. I'm adding that to my list. That looks cool. Question 2, this is specifically for you, but the Bulldogs or the Crimson Tide?
Oh, what a timely question.
I know.
Well, I grew up in Atlanta. My dad is a Georgia Bulldog. I grew up going to the games, and I am so excited that they're the new national champions. So
that's awesome.
How about them Dogs?
They had a great, how about them Dogs? That's good. Question 3, would you rather have super strength, super speed, or the ability to read people's minds?
I'm going to say the ability to read minds, but only if I could turn it on and off. I don't want to know everything at all times.
Fair. That's usually our follow-up. When people say read minds, like, what if you can't turn it off? That's good.
Then speed. Then definitely speed.
Yeah.
So the crazy thing, Alice, so Alan's right. We always have that as a follow-up question. What if you couldn't turn it off? But you're the only person who's ever, like, on your own said, well, only if I couldn't turn it, but not if I couldn't turn it off. And so you clearly read our minds.
It was
So
the first thing I thought of.
skill.
Yeah, taking it to the extreme. I was like, wait a minute, I definitely don't want that.
Yeah, that's like a Twilight Zone episode or something. All right, question 4. What is something in healthcare you believe that others might find insane?
So we recently here, this is another timely question, did the first transoral approach for thyroidectomy.
Wow.
And so we did a combo of transoral and submental with a small incision just right here under the chin. But it's a laparoscopic procedure. You can also do it robotically that allows us to remove the thyroid without having to make a cervical incision.
Wow.
And so when I first broach it with patients, they say, you're gonna do what? So it definitely sounds insane. But we are lucky enough to have done our first couple patients just last week here. So excited to get that program up and going.
That's amazing.
Wait, so you're going in through the mouth? Wow.
So yeah, we make the traditional way is to make 3 incisions just inside the lip, just outside of the gums, and then tunnel up and over to be able to get to the thyroid down here in the neck. A modification is to make the extraction port to take the specimen out just right here under the chin, so we avoid having to go up and over the chin for removal. But yeah, through the mouth and chin.
So random question, just because I'm curious, like what % of patients who would otherwise get a traditional thyroidectomy would be eligible for something like that?
So there's been some studies looking into it. It depends a little bit on your criteria. Certainly with us starting out, we're using very specific criteria. So patients, I'm not doing cancer yet or known cancer. And patients that have inflammation or thyroiditis, I'm excluding at the moment. But sort of, people that have been doing this for a long time, really experienced providers have been expanding that criteria. And it's up to, I think, around 40 to 50% of patients would be eligible if they're interested. Yeah.
Oh, this is the first I've heard of that. Wow. Okay.
Yeah, the big pioneering team is in Thailand. So they were really the first to start it probably in the early 2000s.
Wow.
And then it's been catching on in the US at primarily academic centers, but gaining popularity for sure.
Wow. Okay.
That's really cool. Yeah. Last question that we have for you. This is a pandemic kind of lockdown related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
So I did do quite a few. I baked bread and, I did some of the trendy things, but our major one is that my husband and I got a puppy in June of 2020. So that's Billy. She is now a 90-pound Rhodesian Ridgeback. So she is very active and keeps us busy, and we're having a great time.
That's awesome. So
Alan also got a dog during the pandemic, right?
I did get a dog. She's quite a bit smaller than 90 pounds though. She's 35 pounds, so about a third of that. But I'm curious. There's obviously a ton of like hiking trails and mountains where you are. Billy is with you the whole time, running through those mountains, or?
Oh yeah, she is hard to tire out.
Right.
So we have a great time. We've been hiking and running, and we kind of started out slow until she got about a year and a half, and so now we're fully okay. So I've been trying to get her stamina up. She has kind of short bursts, but but she is right there with me on runs and hikes, and yeah, she just loves being outside and running around. So
that's so cool. Do you surf ever? Or it is...
I have taken lessons, but I have not regularly.
Got it. Okay. No, just a random. I saw a picture the other day or a video of a dog on a surfboard, and I figured, and they were in California. I think they were in San Diego, but just like, you never know what your dog can get up to. You're running with your dog, they're going to run marathons with you, and there's some dogs that are surfing. It's really cool. That's awesome. Well,
that's amazing. That's amazing.
Well, Claire, I just want to thank you so much.
I have seen here. Oh, sorry.
No. Go for it. Yeah.
Oh, I was just going to say, here in Sacramento, we have 2 rivers. And so river activities are a big thing. And so there's a lot of stand-up paddle boarding.
Right.
And so I do see a lot of people with their dogs out on their stand-up paddle boards.
That's so cool.
That's always a fun one. Yeah.
Awesome.
Yeah, that's awesome. Awesome. Well, Claire, I want to thank you for coming on the show today. You brought a lot of wisdom in terms of what you're doing with innovation-wise in surgery, as well as digital technology and how you've implemented that at UC Davis for your patients, really the holistic view that you carry for your patients. And, it speaks volumes to why you're getting such enthusiastic praise from your patients. And I hope some of that knowledge translated today for our audience. I'm really appreciate the opportunity of just being on the receiving end of all the topics that we shared today. But thank you so much for joining.
Well, thank you so much for having me. This has been an absolute pleasure and nice to get to know both of you.
Thanks so much, Claire.